What I really want to do today is kind of open your guys' eyes to some of the effects that we have on patients and how we can use neurology, muscle testing, and a couple other diagnostic indicators as pathways, a guide for treatment. Because as we all know, chiropractic, as great as it is, sometimes doesn't fix everybody. Okay, so what I want to do is kind of open the door on what to do for a patient who's not responding to treatment as they should. The great thing too about chiropractic and just functional medicine, and that it's very non-invasive. I don't know about you guys, but it seems that patients nowadays, they don't want to take medicine. They're scared to death of surgery, and rightfully so. We know, being in the health field, that medicine, for the most part, is kind of like a Band-Aid. It definitely makes you not care about the pain or not feel it, that sort of thing. But in some instances, it does help your overall health, help you maintain, homeostasis. But really, minerals, vitamins, essential fatty acids, those sort of things are what our body uses to actually obtain health. So, you get those patients in that don't have stomach problems because they take a medication, or don't have high blood pressure because they take a medication. It's that false sense of health. Really, the biggest thing, even like with cholesterol medication, well, if my cholesterol is in good numbers and normal limits, then I can eat anything I want, which is the farthest thing away from the truth. Really, it's giving you a false sense of reality that if you can just eat a pill, you can eat whatever you want and be healthy. I get a lot of patients that come, from pain management and that sort of stuff, because they've heard that I've helped other people not have to rely so much on pain medication, or God forbid, get them off pain medication. Okay, get them back into doing what they're doing, and enjoying life and that sort of thing. I feel that you don't have to hit everybody with a heavy hammer. Okay, if you can balance their neurology so all the muscles are pulling right, usually adjustments are really easy. Just slide them right back into place. And because as chiropractors, we understand that you need to move that real quick, but the general population doesn't like having their neck snapped or cracked or twisted real quick. So if you can do it real gently and get the job done, they'll come back to you because you didn't hurt them like the last guy did. Okay, so you want to go easy. Okay, because a lot of patients nowadays are just deteriorated. Their connective tissue is not what it should be, okay, due to poor nutrition. And even, I'm sure some of the older chiropractors can attest that, adjustments nowadays, they don't really hold like they used to, just because those connective tissues aren't supple and strong. So what maybe you were able to get the job done, 25, 30 years ago in 3 treatments, now may take 12, okay, just because the patient is so deteriorated. All right, so again, your bones are getting softer and brittle. These kids nowadays, there isn't much activity. The most activity they get is sitting on their butt playing the PlayStation. So I think their thumb muscles are probably super strong, but other than that, I think their bones are pretty brittle. All right, so just be kind of careful when you're treating a patient. And like I said, kind of like a grandparent. Just go easy with them at first because they don't trust you. They don't know you. When you first come in, and I think it's good to remind ourselves, sometimes by going to other doctor's appointments, what it's like being a new patient. Okay, I think sometimes we take for granted that everybody knows what we do and what it's going to feel like and that sort of thing, but in reality, we really need to explain what we're doing thoroughly to every patient before we do it, because nobody likes surprises. Okay, so you don't want to get in there and just start racking and cracking, and sometimes that's what happens when we don't have time or we're behind 20 minutes. We just got to kind of, move the process along. So take your time with patients that need it. Okay. I enjoy working with patients that have chronic, complex cases, those sort of things, because again, it makes the day fun. Okay, when they've seen 9, 10 other doctors, 3 neurologists, 2 chiropractors, acupuncturists, nutritionists, across the board, pain management, and nobody has really fixed their underlying problems, and that's why they still have their condition. That's what gets them into your office. Honestly, I would think it'd be awesome to work for the Cleveland Browns, try to help them into a winning season. Big Browns fan. Actually, I have a Browns tattoo, and I would love for it to mean something. I like to be a winner. So.
When can you start? They need help.
Yeah, they need help, right? To be honest with you, I'll tell you what I think it is. I think everybody on the team has vitamin D deficiency. No, seriously, it's rapid in northeastern Ohio. And if you're a person of color, you actually usually tend to have lower vitamin D. So, and I think as the season goes on into the fall, I think people are getting low vitamin D, and I think their stamina and energy is in there. Okay? If I was the team physician, I'd be doing blood work on those guys like every week to make sure everything, biochemically, they're functioning optimally. Because if you have vitamin D deficiency, muscles aren't going to work right. You are not going to be as fast as the other guys living in San Diego and getting all the sun. Okay? I mean, it just makes sense. I guarantee that New England, their sports chiropractor, he's a applied kinesiologist. Tom Brady, look at him. He's, 39? He's still on top of his game. He has like a perfect nutrition regimen, perfect exercise regimen. Underneath all that, was it Dr. David Leaf? He's a fantastic, world-renowned applied kinesiologist. Okay, so it's like you got to get everybody's biochemistry right, especially when you're in sports and doing that sort of thing. You want them to be elite athletes. Oh man, that'd be awesome.